Navigating the world of food choices can be a challenge for diabetic patients, with certain foods posing a significant risk to blood sugar stability. Avoiding these foods can be crucial in maintaining optimal health and managing diabetes effectively. Here are 10 bad foods for diabetic patients. Number 1. Sugary beverages. Drinks like soda, sweetened tea, and energy drinks are packed with added sugars. They provide a rapid influx of glucose into the bloodstream, causing sharp spikes in blood sugar levels. These drinks lack essential nutrients and can contribute to weight gain and insulin resistance. Number 2. White bread and pasta. Made from refined flour, white bread and pasta have a high glycemic index, meaning they are quickly digested and absorbed, leading to rapid increases in blood glucose levels. They lack the fiber and nutrients found in whole grain alternatives, making them less ideal for blood sugar control. Number 3. Pastries and baked goods. Items like donuts, cakes, and cookies are high in sugar and unhealthy fats. They not only lead to quick spikes in blood sugar, but also provide empty calories with minimal nutritional benefits. Consuming these regularly can lead to weight gain and increased insulin resistance. Number 4. Full-fat dairy. Products such as whole milk, cream, and full-fat yogurt contain high levels of saturated fat. Excessive saturated fat intake can worsen insulin resistance and increase the risk of cardiovascular disease, which is a concern for diabetic patients. Number 5. Processed meats. Sausages, bacon, and deli meats often contain high amounts of sodium, unhealthy fats, and preservatives. These can contribute to cardiovascular issues and increase the risk of developing further health complications in diabetic individuals. Number 6. Fried foods. Foods like French fries, fried chicken, and other deep-fried items are cooked in unhealthy oils and are high in calories. They contribute to weight gain and poor blood sugar control due to their high fat and carbohydrate content. Number 7. Sugary cereals. Many breakfast cereals are loaded with added sugars and lack sufficient fiber. They can cause quick spikes in blood sugar levels shortly after consumption, making them a poor choice for breakfast. Number 8. Candy and sweets. Candies, chocolates, and other sweets are high in refined sugars and provide little to no nutritional value. Consuming these can lead to significant blood sugar spikes and can make it difficult to manage diabetes effectively. Number 9. Fruit juices. While natural, fruit juices are high in concentrated sugars and lack the fiber found in whole fruits. Drinking fruit juice can cause rapid increases in blood sugar levels, unlike eating whole fruits, which release sugar more slowly. Number 10. White rice. This staple is high in carbohydrates and has a high glycemic index, meaning it is quickly converted to glucose in the bloodstream. Consuming white rice can lead to rapid spikes in blood sugar levels, making it less ideal for diabetic patients compared to whole grains like brown rice or quinoa. Avoiding these foods can help diabetic patients maintain stable blood sugar levels and support overall health.